Namaste viewers, welcome to Sri Anantha YouTube channel. Today we have Professor Dr. A.V. Srinivasan Swamiji with us. Let's ask Swamiji about the causes, effects and the Marma Chikitsa treatment for the problem of paralysis. Swamiji, nowadays many people are suffering from paralysis. Can you please explain more about this and can we come out from that through Marma Chikitsa?
Embodiments of love. Today our topic is the paralysis or the brain stroke. What could be the cause of a brain stroke and paralysis? There are 4 types of causes which leads to brain stroke, and as a result a patient have the impact of paralysis. The first one is at the childhood. If mother is not having a protein food, the delivery of that child, if you see, it will be anemic. So such children will develop with a disease called arteriovenous malformation. When any such clots which takes place in the arteries and in the veins, that leads to malformations of the tissues, bones or capillaries, tendons, muscles. So in any part of the body that malformation may take place. This is one case. And after some time, or for any people who are under malformation or those who have developed all of a sudden arteriovenous necrosis. This necrosis takes place only when there is an injury to a particular organ. In that particular organ, if any clot takes place, especially in your calf muscles or in your thigh region or in your spine, these are the main areas where if any kind of injury has happened, that may lead into necrosis. So that necrosis further it will make depletion in the growth of the body, as well as the clot will aggravate more in all the arteries and veins, and as a result that may lead into stroke. So any such accident or any such injury always leads into brain stroke. For some people it may lead into death, but for major of the people who have a minor accident or minor injury, that will have a clot on that particular organ in that particular artery or the vein, and due to that it results into brain stroke. So this is arteriovenous necrosis. And the third case, it is because of the hypertension. Most of us commonly, if we see today, we develop hypertension due to stress. Whether it is at workplace or at home, we always find some kind of stress due to our sensitivity. So if we are more sensitive, we will develop that much of hypertension, which changes the parameter of our blood pressure, and as a result that also lead into clot in your brain, and finally the impact will be brain stroke. So where there is a brain stroke, that will have as a consequent result as paralysis. Now the fourth is the lifestyle disorder. Because of our food habits, like when we go for a junk foods, especially the oily foods, that will accumulate more of debris and result as triglycerides. So that is one factor. And the second one, if you see, those who are genetic diabetes or gestational or type 1, type 2 diabetes, they also develop lot of glucose in their blood cells, and finally that leads into low density lipoprotein fats. So when it turns into low density lipoprotein, that may also lead into clot in the arteries and veins, and finally result into brain stroke. So in this way, these 4 types categories are there a person undergoes a brain stroke. Even whether it is AVM, arteriovenous malformation, or necrosis, or hypertension called atherosclerosis, or otherwise, whatever the diabetic cases, gestational type 1 and type 2, such cases, all these cases sometimes may also lead into cardiac arrest. So, cardiac arrest will not lead into paralysis, whereas brain stroke always lead into paralysis. This is what the difference and the cause and symptoms one has to understand for a brain stroke and paralysis. Now, the next stage is whether a patient can go for a treatment and which type of treatment will be beneficial without any other impacts, adverse impacts. It means I will not suggest for the surgery, because most of the cases we should not make the intervention of the surgery. Rather, whatever naturally it can be cured, we have to accept that methodology. In that case, Marma Chikitsa is one of the most predominant treatment protocol, where all the arteries and vein, wherever the clots are, that can be cured with manipulation and stimulation, little bit of triggering the vital points with some pressures. So with that, definitely all the debris which are accumulated either in the heart or in the brain, whether it is in the form of triglycerides, or it is in the form of malformation, or in the form of necrosis, or deep vein thrombosis, or stenosis, whatever it may be, all this can be detoxified through Marma Chikitsa, through manipulation and stimulation techniques within 5 to 10 days. And after that, even the case of necrosis, if you see, if it is a second, third stage, that can be reversed into early stage within 15 days. In case of brain stroke, if a patient has underwent for long 15 years or 10 years like that, and who is in the bed, that person can be treated within 15 days and his position can be reversed to the extent of 50%, where with the support of some walker he can walk on. If there is cramps in his fingers, that can be cured. Similarly, the persons who had recently a kind of brain stroke and paralysis within 5 years, that can be cured with the ultimate result of 80%, where without any support they can walk. If any slurrish speech is that can be reversed and they can speak well. So in this way, the Marma Chikitsa is a boon to the people, where one can undergo the treatment for 10 to 15 days maximum and get the best result for such kind of atherosclerosis or necrosis, or otherwise brain stroke and paralysis. So I request all the patients or the viewers, whomever are suffering with such kind of symptoms and ailments, they can call us on the displayed number and get an appointment and get treated and live happily. Thank you, one and all.